everybody. We're going to start in just a couple of minutes, so we're waiting for a few more people to get on. Hi, Caroline. Thanks for joining us today.
Yeah, you're welcome.
Hey, Marie. Hello, Maureen. Danielle.
Hello.
A lot of people logging on, so in just about a minute or so we'll start. All right. Excuse me. All right. Well, I think we're ready to go. So thanks everybody for joining us today for a panel facing post-COVID frontiers for people living with scleroderma. What do I need to know? I'm Brett Toombs. I direct the Scleroderma Patient-Centered Intervention Network, or SPIN, and we're here with a great panel today. A couple of quick notes. We've, all except for the panelists, all the cameras and sound are muted. We'll stay that way today for bandwidth purposes. We have a long list of questions that people submitted prior to the panel today. And also, if things come up during the panel, if you have additional questions, please put them in the chat, and we'll do our best to get to as many questions as we can. Please, if possible, try to avoid side chats in the chat. It makes our job a little more difficult as we're trying to pull questions out and integrate them into our list. I'll be co-moderating today with a good friend of mine, Maureen Salve from Ontario. Maureen?
Hi, how are you doing today, Brett?
Great, thank you. You?
Good, thank you. So it's my distinct pleasure to introduce the first of our two of our three panelists today. We're honored that these esteemed doctors were willing to take the time to address our many concerns and questions about COVID-19 and scleroderma. Dr. Carolyn Quash is a professor in the departments of microbiology, infectious diseases and immunology, and of pediatrics at the University of Montreal. Dr. Quash is a clinician scientist who is supported by the Fonds de Recherche Québec Santé, Chercheurs Boursiers du Mérite, and is now the Canada Research Chair, Tier 1 in Infection Prevention and Control. Her research interests are in infection prevention, both healthcare associated and vaccine preventable diseases. Dr. Quach is a former chair of the National Advisory Committee on Immunization for the Public Health Agency of Canada from 2017 through 2021, and former chair of the Quebec Immunization Committee until 2019, which she is currently chairing again on an interim basis. She is a former president of the the Association for Medical Microbiology and Infectious Diseases Canada, and is a fellow of the Canadian Academy of Health Sciences. Thank you so much for joining us, Dr. Quach. Dr. Marie Hudson is a rheumatologist at the Jewish General Hospital and Lady Davis Institute for Medical Research in Montreal, and an associate professor in the Department of Medicine at McGill University. She pursues research in systemic sclerosis and is a founding member of the Canadian Scleroderma Research Group and a member of SPIN's steering committee. Dr. Hudson is co-director of the McGill Interdisciplinary Initiative in Infection and Immunity, which provided over $4 million to support more than 60 innovative COVID-19 research projects, including the study of new treatments, Made in Canada COVID-19 Diagnostics, Addressing Vaccine Hesitancy, and SPIN's COVID-19 Cohort and SPIN Chat programs. M14 recently funded work to test the antifibrotic properties of mesenchymal stem cells in scleroderma. Dr. Hudson is a practicing physician and has cared for many people with scleroderma as they have navigated the uncertainties of the pandemic. Thank you for joining us, Dr. Hudson. Brett?
Yep, I'll introduce Danielle Rice. I'm very happy to do this because at least for a few more months, she's a doctoral student under my supervision at McGill University. She's currently working as a therapist and a psychology resident at St. Joseph's Healthcare in Hamilton, Ontario, Canada. And in this role, she provides therapy for caregivers and patients of chronic health conditions. Danielle has worked with SPIN, our Scleroderma Patient-Centered Intervention Network, since 2015. Can you believe that, Danielle? And has been active in the patient community during that time. So many of you, I know, have attended presentations that she has done for patients and family members. And some of you who participated in the SPIN chat program at the beginning of COVID-19 will have had the benefit of Danielle's guidance on steps to cope with mental health challenges in the pandemic. So with that, we'll get on with this, and I'll turn it over to Maureen to begin questions for our panelists. Maureen, you're muted.
Apologies. Sorry. What steps should we take to return to normal as public health measures are lifted? If any of you would be kind enough.
I guess I can get started. So it's a hard question because this is really a fine balance between trying to get back to normal for as many people as possible while protecting the most vulnerable. And I think that's where you guys really have an issue, and I understand that fully. I don't have any immunocompromising condition, but if I had one, I would also feel quite uncertain about the next few steps. So I think what we are really trying to do is to allow as many people to go back to their normal lives so that, you know, mental health is also taken into account for the vast majority of the population. At the same time, I think that jurisdiction where mask mandates, indoors at least, are still on, are acting a little bit more responsibly, I would say. And I say that because Quebec still has it on, and I fully agree with that. I think that decreasing the risk of transmitting the virus while you're sitting at a theater or a movie is already something great. And for more vulnerable people, it's a matter of understanding where your risk is highest. So, you know, a restaurant that is not well ventilated is probably pretty bad. But the thing is, it's really hard for people to know what type of ventilation exists where so that your risk decreases. So basically what you aim to do is be as much as possible outside when you interact with people. If you're inside, aim to wear a mask and have others around you wear one as well. And we need at the government level to make sure that people understand that they are contagious for 10 days and not just 5. We've been allowing people to get out of their house after 5 days, but trying to make them understand that if they needed to, we wanted them to wear a mask and not go sit in a restaurant or a cafe without a mask. And understand also that if you have symptoms, you stay home and you get tested. And that with BA2, so this new subvariant of Omicron, the maximal viral load is not on day 1. It is likely more on day 4 or 5. So if you have symptoms, you really stay home and you test yourself again on day 4 or 5 before declaring that you're negative. It's a lot of steps to take for people who do not think that it is important to know that they have COVID because they consider it as a cold. But I have to say that for a sizable proportion of the population, it is not just a cold. So for vulnerable populations, on top of all that, get vaccinated for sure. A lot of people with scleroderma would have access to a second booster dose because you're immunocompromised enough. And so I would absolutely go and get that and stay on top of treatments as well, so that if you have COVID, Paxlovid or sotrovimab might be warranted for you. And at that point in time, you call Dr. Hudson to know if you're able to take it or not. So I'll stop there. Thank you.
Thank you.
Thanks, Caroline. That's great. And I'm just going to add that this is the best time to be asking about how can we get back to normal, because it's springtime. And I tell my patients, okay, so let's all take a deep breath. It's springtime. You want to get back to normal. Let's all go outside. Let's do things and enjoy the sun. And slowly, while people like Caroline and other public health people are gathering information, let's regroup and review the information. So I'm encouraging people to be as normal as possible outside for the summer months, and then we'll take it from there in the fall.
So following all these recommendations hasn't been without controversy, unfortunately. And some people in our group today want to know how they should respond. Maybe I'll turn this over to you, Danielle, as a mental health specialist here. You know, how they should respond when people make comments at them or act angrily when they are wearing masks or following the regulations.
Yeah, and I mean, the first thing I'll say is I'm sorry for anyone who's experienced this. I mean, it's unfair to be verbally attacked in any situation, but especially given a health decision that's for yourself. And what I want to have you go away with today for this question, if you are, someone says something negative to you, gives you a verbal attack about the mask, I have 4 words I want you to remember, and that's, it's not about you. If you hear someone say something about your mask, it's not about you, I promise. They're yelling, whatever that is, there's something going on that's making them not feel so well, and you have just unfortunately been the unfair target of this. The one thing I sort of picture is, imagine a hot potato, someone's not feeling so well, whatever's going on with them, they see your mask, it makes them upset, they want to throw this hot potato, they don't want to feel that anymore, so they're trying to give it to you. You can let that hot potato fall. It's not about you. You can take what they said and you can keep going. I recognize that some people may find this hard and you may want to say something. You can simply, if they say, hey, you shouldn't be wearing a mask, okay, and you keep going. If you want to say something back, maybe something you say is, you know, I have scleroderma and this is helpful for me. And then they can hopefully go and Google what scleroderma is, and maybe they'll donate to Scleroderma Canada and they'll learn something for that day. So that's what I want to impart on you is it's not about you. And I want you to remember that.
Wonderful. Thank you. So another question here was, how should we encourage our young children to live their lives when we are vulnerable to COVID? Extracurriculars, play dates, and parties. How should we be handling that?
Well, Mary, do you want to go or should I go?
No, go. You give the public health and I'll tailor it to scleroderma after.
I think we should let the children play as much as possible. They need this to grow, to socialize, to develop, to learn. And so, again, I understand the risk to parents, but if you are vaccinated, the risk of having major complication is really lower. And we do have now treatments if ever you were to become positive. So I think we're in a much better position than in March 2020. And what seems to be happening with Omicron and the BA.2 variant is that even though it is much more contagious, it is less virulent, which means that in terms of proportion, we have less percentage of people ending up with complications. So let them play.
Yeah, I totally agree. And what I like to do with my patients is I like to put things in perspective. So I've looked at the literature and it says scleroderma patients are at 25% greater risk, 30% greater risk, 50% greater risk. But what's the baseline risk? Because all those increased risks are over baseline. So what's the baseline? So there was this really great paper of Canadian data that was published about a month ago of patients with autoimmune inflammatory diseases, including scleroderma. Scleroderma was a small subset, but they did include scleroderma patients. And they said that patients with autoimmune diseases were at overall, generally speaking, 25% greater risk than other people. But what does that really mean? So it means that people in the general population were, for example, the risk of hospitalization was 5 out of 10,000 people. So a 25% greater risk is actually 6 out of 10,000 people. So yes, the risk is 25% greater, but it's incremental. It's a small increase in risk. So you have to weigh the absolute risk, not just the relative risk, in terms of everything else. Danielle is going to talk to us about mental health. There's our children, there's our lives, there's our own personal, well-being. So I think that we need to be careful, but we need to weigh the risks, in an intelligent way.
Well, Marie, thanks for clarifying that. I think that's a really important concept. If you think about the lottery, if you have a 1 in 10 million chance of winning, I suspect if we said it was 2 in 10 million, most of you wouldn't went out and buy your lottery ticket today because it was double or 100% higher. And I think the same thing you illustrated so nicely applies to disease, right? Or risk, that it's just the percents get headlines, they look big, they catch people's attention, but it really big, the number of difference is very small. So thanks for putting that in such clear terms. That relates to another question. We have lots of different questions actually that relate to the same idea that, we have these public health recommendations. Should people with scleroderma be doing anything different, or is that really a personal decision about risk benefit that they should be evaluating, given that they might be at higher risk?
So maybe I'll tackle this one first, because the people with scleroderma, they're all different. Okay, so there's no such thing as a person with scleroderma. Everybody's different. So I think that we have to be a little bit more, careful about how we answer that question. If you are a person receiving immunosuppression, some of the immunosuppressive drugs, that's where I think we have to be particularly careful. But I have a whole lot of my scleroderma patients who are on medications for their Raynaud's, medications for, other symptoms for their reflux and so on, that does not in and of itself increase their risk. So I think that if you have questions about that, you need to speak to your rheumatologist and ask them, what is my risk in relation to COVID?
Excellent. So how to help boost your immune system and stay safe? I'm concerned that I'm going to have long-term health issues if I get COVID again.
Yeah, so if I get COVID again, that implies that the person got COVID, that they got better from COVID. And I don't know, Caroline, correct me if I'm wrong, but already that's good in the sense that if they were able to mount a response against COVID, that already means that their immune system is probably better off than other people who didn't have COVID. And the reality is everybody has to be careful. Everybody, so yes, the risk of reinfection is real. We have seen some patients get reinfected, but hopefully if you were able to get over it the first time around, it means that your immune system is able to get over it the next time.
And I think what needs to be understood is that it's not because you get COVID twice that you're at high risk of long COVID. I think, we haven't seen that yet. In fact, as Marie was saying, when you get COVID the first time, usually the second time around is milder. And so if you've mounted some immune response to the first infection, you should be partially protected at least against the second. And in terms of boosting your immune system, I mean, there's no real data that shows that anything really works. We've tried, people have tried vitamin D, and it's all observational data that seem interesting, but nobody has been able to prove that if you take X amount of this vitamin or that other, that it actually is better. I think what we want is to live as healthy life as possible, and so be exposed to the sunshine enough so that we have vitamin D. And so, as Marie was saying, springtime is coming, we should be able to make it ourselves. But I mean, personally, the only vitamin I take all year round is vitamin D, because I'm dark skinned and I know that in the winter I don't make enough of it. But whether or not that saves me against anything, I can't say. So it's really a matter of trying to live as healthy of a life as possible, but no real miracle, unless you know of any, Mary.
No.
Wonderful.
Well, I guess really the clear message to do is get your vaccines and get your boosters. I think I'm a psychologist, I feel comfortable. I think I can say that one. That's one of the few things I can comment on here. So I'll go ahead and do it. So that was a question about getting the fourth shot or the second booster. And I think that's a clear yes, that you should get your vaccines. Danielle, all of us have things that most of us maybe have things that we're scared of, even though we know maybe we shouldn't be scared of those things and they really frighten us. But this is even a little bit different because people have been scared of COVID for a while for good reason. And now someone out here wants to know how can they overcome they're high anxiety, they want to socialize with friends or other people, but it makes them feel anxious. What can they do to reduce that anxiety and go out and begin to do things they used to do and enjoy?
Yeah, I really like this question because the question was, how can I overcome the high anxieties? It wasn't, how can I avoid the social situations? So I wanted to highlight that you thinking, or anyone thinking about socializing, that's a great first step. This is something that you may have avoided thinking about for the past couple of years, and that could have caused anxiety in itself. So first, I also want to say, manage your expectations. If you're going into a setting that is something you've been avoiding or that has been different, I'm in Ontario where there is no mask mandate right now. So if you're planning to go socialize in an indoor setting, that may feel uncomfortable for you, and that would be expected. There's going to be levels of stress, anxiety, and uncertainty, but you having the confidence that you can tolerate those levels of uncertainty is helpful. Knowing that I've sat in uncomfortable situations before, I've sat in uncomfortable medical tests, I've sat in uncomfortable x-ray machines, MRI machines, blood tests. I can sit in a bit of uncomfort for that 1 hour I want to spend with my friends, and maybe I'll make my decisions that work best for me. So maybe that's wearing a mask, or maybe that's wearing a N95, or going to a ventilated setting, or staying outside. So trying to keep your expectations in line with what would be expected, which is some anxiety. And trying to set yourself up for what you feel comfortable with. So that may mean you won't be spending time with people that are vaccinated. Whatever it is for you, set your sort of limits and boundaries and follow that, so that you can reflect and go home and say, I did what I could. I made this decision consciously, and it wasn't just dragged somewhere that I now regret. So I think those are a couple things to keep in mind to hopefully reduce your anxieties and fears in a time that will definitely result in some level of discomfort.
Those are great answers. Thank you. Are there similarities between long COVID and scleroderma, and would this make it more difficult to recognize?
Yeah, so from my point of view, I don't think I know enough about long COVID yet. And the reality is, I think we all don't really know what long COVID is yet. Of the patients and what I've read from long COVID, there is a lot of fatigue, brain fog, general unwellness. And those are a lot of symptoms that I hear from my scleroderma patients. So yes, I do see some overlapping symptomatology. The question is whether what's driving these symptoms is similar or different. We don't know that yet. And so at the end of the day, I think it comes back to saying, please don't get COVID, and don't even go and try to test the idea of getting long COVID, because you already have scleroderma. So let's deal with the scleroderma, and let's protect ourselves from, confounding medical issues. That's my idea on that.
Okay, thank you. Marie or Caroline, do you know if there are any data on the effectiveness of vaccines for people on immunosuppressants?
There have been a couple of trials where it's not clearly effectiveness data or efficacy data, but more immune response to vaccines. And so again, as Marie was saying, it really depends on your underlying immunosuppression. So a patient with scleroderma with no immunosuppressive drug, I would suspect, would respond as well as an immunocompetent patient of the same age. However, if you are on a biologic, rituximab, and I don't even know what you guys treat scleroderma with, but rituximab in particular is known to decrease the response to everything because you can't make antibodies, which does not mean that your cell-mediated immunity is completely off. So it's absolutely impossible to say for all scleroderma patients, or rather, I should say, people living with scleroderma, that that some might respond perfectly well, and others, because of the underlying medication that they're taking, will respond less. But all we know is that for person with immune suppression, when you give 3 doses as a primary series, their response is much better. And so for those particular individuals, they should now be at their 5th dose. So their second booster would be their 5th dose. And usually they have a response that is decent, not the greatest, but decent.
I'll just add, and yes, Caroline, we use rituximab. We're using it increasingly. And I've seen data with almost every other immunosuppressant that we use that it does blunt the effect of vaccination. So we use a lot of mycophenolate, for example. We do use abatacept on certain, we use JAK inhibitors and so on. So definitely all of the drugs that we use have been associated with blunted responses. But I always like to turn this around and say, for every question, so yes, it blunts, so what's the solution? And I'm so lucky to be part of a research project coming out of Quebec City right now, trying to see if there are ways to vaccinate our immune suppressed patients that might overcome this blunted response. And one of the ideas in this project that I'm part of is whether we should be mixing different vaccines. Is this mix and match type of vaccination approach way to overcome? And in fact, public health is recommending a 4th dose, possibly eventually a 5th dose. So there are solutions that we're looking for to overcome this blunted response to vaccination in our immune suppressed patients.
It's really fascinating. Thank you. What treatments exist for people with scleroderma and ILD if we get COVID?
So I have been on the wards a lot, on the COVID wards too much. And I have seen, mostly just because it's a more frequent disease, I've seen lots of patients with rheumatoid arthritis. I've seen some patients with lupus. I have not seen personally scleroderma patients, but generally speaking, and then obviously we've seen patients with inflammatory bowel disease and multiple sclerosis. And generally speaking, when our patients develop COVID, we treat them just like every other patient with COVID. And so the hospitalized patients will get high-dose steroids, and then and Caroline can go into this, but there's now newer treatments. That's the other, I think, important take-home message for our patients. We have new treatments. We have antiviral drugs. We have very strong anti-inflammatory drugs for patients who get into a lot of trouble. So we tend to treat our patients with inflammatory diseases the same way as we would treat any other COVID patient. We don't do anything over and above that.
Thank you.
Sorry, maybe just to add on to what Marie was saying, is that if somebody with an immunosuppressed drug is catching COVID, I think you have to act quickly, because you have 5 days since the beginning of symptoms to get Paxlovid, which is the oral antiviral that can now be delivered, at least in Quebec, in all pharmacies. So you don't even have to run after your physician anymore. You can just walk into a pharmacy, and as long as there's no drug interaction, usually you should be able to get it. And having treated a few patients who were immunosuppressed, they told me, it was night and day. Within 2 days, they felt much better. So I think this drug actually worked quite well. It's just restricted to patients with immunosuppressed conditions, so that a healthy 60-year-old who's vaccinated would not have access to it. But it's very possible that if you are taking immunosuppressive drugs, that you'll be able to get it quickly. And so just remember to ask. And if the pharmacist doesn't know, they'll call your physician just to make sure that there's no drug interaction. But that, to me, is the main point to remember.
Great, thanks, both of you. So lately, our provincial governments have been doing less testing and less reporting. And one of our participants was wondering, to keep track of risk out there as things change, what should they be looking at, or what kind of information is important? Should they be looking at the number of cases, the positivity rates, hospitalizations, wastewater levels that are reported? What can they do if they want to understand what's happening around them?
Well, I don't know where this participant is, but in the province of Quebec, you can still look at the percentage of positivity that is posted daily on the INSPQ website, because what we do is we still test our healthcare workers with every single symptoms. So because our healthcare worker really represents what's happening in the community, they do not catch it at work. They catch it going to restaurants and seeing friends and having children going to daycare. You have then an ability to know what's happening, at least in the province. And if you are able to get data a little bit more specific to your own region, that also is quite helpful. In provinces where wastewater positivity is also available, that's a great, it's a great look at what's happening, because that drains tons of people's poop. And so you have an idea of how many people are actually positive. In Quebec, that's not available easily. I mean, they are gearing that project up again, but in Ontario, Alberta, BC, those data are amazing. And so yes, look at that and it'll give you an idea of what's happening in your community.
Excellent.
Yeah.
Danielle, this one's for you, I think. I feel like wearing a mask for the rest of my life. Am I exaggerating?
I think if you feel like wearing a mask because it makes you feel okay, that's what's most important. You know yourself best. If that makes you feel comfort, then I think that is right now what we're trying to manage. If you are able to go out because you're wearing a mask and otherwise you'd be staying in, I say wear your mask. I think the question about is, am I exaggerating or am I going too far? You can play that day by day. That's how you feel right now. Maybe 3 months from now, that's going to be different. Keep checking in with yourself. Are you willing to go to, outside without a mask? Are you willing to grab a lip chap from your shoppers and do self-checkout one day to see how you feel? It doesn't have to be today. That can be, again, 2-3 months from now, peak summer when most people are outside. But for you, you know yourself best. And if that's going to make you feel well and continue living your life as close to quote unquote pre-2020, I'll say, not normal, pre-2020, then you do you, and whatever's going to keep your mental health well, I'm on board for. That's my opinion.
I'm just going to add to that as well, that as a non-scleroderma patient, I will wear my mask as much as possible to protect all these other patients, So you may be worried from scleroderma, what message am I sending out? There are people like me who are otherwise generally healthy who will still be wearing our masks. We're all going to be wearing our mask. I don't think I will ever, Caroline, maybe I'm wrong, but I don't think I will ever see a patient without a mask for the rest of my professional career. And I think that's a good thing. It's a good thing for our patients, So in a way, some of the things that we've learned from this are going to be positive outcomes of the pandemic.
Great, thanks, Maureen. So what other, that's an interesting point you make, that, you think the rest of your career you'll be wearing a mask as you're going forward. So people have made lots of changes during COVID. We could go down the list, but I think we all know what they are. What kind of things that have we done during COVID are with us for good, and what kind of things do you think those kind of maybe go back to being more normal as we go forward, particularly for people living with scleroderma, whatever that is, as you said, Mary?
Yeah, so for me, two things. I think so. I will be wearing a mask, and I'm doing it mostly to protect my patients and not just scleroderma patients, but because I see a lot of scleroderma patients. I think the other thing that we will be taking out of this pandemic is telemedicine. And I think telemedicine is a two-edged sword, in the sense that I think that it's a great tool for many of our patients, but it's also sometimes I worry that our patients say, no, I'm okay. Can we just do this on the phone? And I sort of am an easy pushover, and I say, okay, we'll do it on the phone, but next time I want to see you. And the next time things have changed. So there's still a learning curve, I think, in terms of how we're going to use telemedicine moving forward, and to do it safely for our patients.
And I think two other things that I would like to see change is to make sure that ventilation settings in public places are displayed and are thought out before renovating or whatever, but are able to find for people. So I was impressed to say that I called a hotel recently in Montreal because we wanted to have a meeting, and they were able to tell me right off the bat, 100% fresh air, MERV 8, the filter in was MERV 8, filter out was MERV 11. I was impressed. I mean, it's not usually that you're able to get that type of information, but so not just about hotels, but gyms, restaurants. The US have ASHRAE regulations that we do not follow, but if we were to follow them, it would be much better for buildings, public spaces. The other thing is for people with symptoms, that they would stay home until they feel better, before going home, right? We had this view of even for our children when they were going to daycare. I don't know, Mary, if you did that, but kid was sick in the morning, I would give them Tylenol and Advil, knew that it would keep their fever down for 48 hours, 4 to 8 hours. I would able to drop the child in daycare, go do my day. And by the time the fever was up again, they'd call me and then my day would be finished. I would have seen my patients. I would pick the kid home and, we would get on with life. But I think that we are realizing that doing so spreads disease. And so not to say that we have to stay home every time our nose itch, but at least make sure that if our nose itch and we're going outside, we wear a mask, even though it's not required. So all of that, I think, will have changed the way we see life. We might be looking a little bit more like Southeast Asia. We're going to be like Tokyo now.
Mhm.
Yes, I can see that absolutely being the residual effects of the pandemic. What is generally a good way to respond to a full return to office request where remaining at home is safer for me? In my situation, it's an open air office environment. Some colleagues are openly anti-vaccine.
I have been writing a lot of letters advocating for patients who can stay home, who want to stay home, to stay home. So if they're as productive and if they're, I think if they're, especially if they're immune suppressed, and I think that it's better for them to stay home and, they're happy about that. I write a lot of letters to support that. Now we'll have to see, how employers respond to that. Again, yesterday I had a young man, really, he says, if I can't work, I don't get any money. And I said, but can you work from home? He said, I can do everything from home that I do at the office. Well, I said, well, let's try to get you to stay home.
Yeah, and if I can just add that exactly what was said, that's what I would hope is that anyone can work with their physicians and specialists, rheumatologists, to be able to stay home where it makes sense, and work with OC Health and your HR team to connect with your team. I also just want to think about this question in terms of all or nothing thinking, where perhaps your work is not so supportive of the letter, but does your work have to be all from home or all in the office? Are there ways that you can find those shades of gray where, okay, I'll go in for half a day on Wednesday mornings when I know it's the least busy from 8 until 11 for the one in-person meeting with masks on that's required. So trying to find those, doing a bit of problem solving if you're not able to completely stay home and there isn't that support, trying to offer some in the middle recommendations that doesn't necessarily require you to be fully in the office from 9 to 5, because perhaps that increases your risk more than just going in, showing some face or doing a couple meetings with a mask on. So just remember, perhaps it doesn't have, if you're not getting the support to work fully from home, maybe try and find a middle zone there that would keep everyone happy.
So someone wants, excuse me, someone wants to know if it's a good idea for someone to use an N95 mask versus the typical mask that we're all running around with. And if it is a good idea, where would they find them and get them fitted?
Brett, your sound is not great. I think you were asking about N95 and versus regular mask. So for sure, N95s filter better. And their main advantage is that they are better fitted to your face so that air doesn't leak around. Because actually, if you have a good procedure mask that is well fitted, the filtration is approximately the same. So over, the ASTM 2 or 3, the good quality ones, filter over 95% of small particles down to 5 microns, which is what you want to stop with COVID. The only problem is that oftentimes you are not able to make a good seal around your face. So either you find a smaller one, so I wear pediatric masks because the other blue ones are too big for me, or you tie them. So the procedure mask, if you have to tie them, you can't just crisscross the ear loops, because then everything just enters through your cheeks. You actually you can look on the internet, they have tons of videos, but what you have to do is make knots like really close to here, and then you tuck it under, and at that point in time it looks a little bit more like N95. Unfortunately, in Canada, you're not able to buy N95s. Even if you're a physician and you try to buy from your regular provider, it is really hard to get. But if you go to Europe, they actually sell FFP2 masks over the counter. Or if you want, if you go to Canadian Tires or hardware stores, you're able to find industrial N95 masks. The only difference between the industrial and the medical is that it's not protective against wetness. So if you're not expected to be having a flash of blood in your face, I think it's okay. You can wear those industrial masks and they will filter the same. The most important thing is to learn to fit check. So again, if you Google fit check technique, you will see how to make sure that once the mask is on your face, that the air actually is filtered through the mask and not around it, because again, it is too large. You might have to do a little bit of try and errors, essai erreur. This is my non-good translation, but to make sure that you have the mask that is best suited for the shape of your face. But so look at industrial N95s. Those are you're able to find them, and the protection is actually the same except for the impermeability, which really it does not matter unless you want to take a bath.
Okay, thank you.
Excellent. Somebody's asking, I keep hearing the term immune suppressed, and I realize I don't know what that means. Can you help?
Yeah, so maybe I can tackle that. And you know, all of these questions, it's never black and white. Okay, there's always a different shade. So the immune suppressants that we use include steroids, so prednisone or cortisone, but low dose. And generally in scleroderma, we use very low doses that are probably not that immunosuppressive, but we do on occasion use higher doses for different manifestations. So if you're on prednisone certainly above 20 milligrams, your immune system is not able to respond to infection normally. That's why you are immune suppressed. So that would be the first one or one of the more common ones that we use. We use mycophenolate or Cellcept or Myfortic. Definitely what this drug does is it slows down your immune, because mostly in scleroderma there's immune hyperactivation. So the medications that we give try to suppress this immune hyperactivation. So we use lots of mycophenolate or Cellcept or Myfortic. That is an immune suppressant. We use increasingly rituximab or Rituxan. There's different ways that are different companies that manufacture it. Ruxience, there's different names for this drug. And again, this will blunt your immune response. So, so anything from steroids to rituximab to mycophenolate will be the more common drugs. Where I say, you know, there's lots of gray zones is methotrexate. We still use quite a bit of methotrexate in scleroderma for various manifestations of scleroderma. And I personally, and maybe I shouldn't say that in front of a public health expert, but I don't think methotrexate is an immune suppressant. It's an immune modulator. It calms your immune system, but I've looked at the literature before. It does not really increase your risk of infection. But in some different public health documents that we'll see, methotrexate, because it's often associated with autoimmune diseases, will be considered an immune suppressant. So depending on what literature you look at, methotrexate may or may not be considered an immunosuppressant. But the fact is, if you're on one of these drugs, we're playing with your immune system. And the moment that we start to play with your immune system, it means that your immune response to infection is not an otherwise normal response. And so from that point of view, you are immunocompromised. Maybe that's the better word. And we have to take better care of you if you are using one of these drugs that will compromise your immune response to infections.
I agree, Marie. To me, methotrexate is not an immunosuppressant, and I don't know if you're seeing this in the adult world because I'm a pediatrician. However, the children who are on various immunosuppressive drugs, even though they get COVID, they do not develop any more complications than others. And in fact, it's as if because you were suppressing this inflammation, the complications that usually arise from COVID, which is this hyperinflammatory syndrome, does not seem to happen. I don't know if you're seeing the same in the adult world.
So it's really early and it's very interesting, and I'm very curious how this will pan out. But one of the drugs that we're starting to use more in scleroderma is actually tocilizumab. And so I have patients on tocilizumab who for their scleroderma, and I'm wondering, is it going to protect them? And tocilizumab for the patients who are here is Actemra. And what you should realize is that this drug has been used to treat COVID. And so if I have some patients who are on the tocilizumab for their scleroderma, will it protect them from more severe disease? I don't know. Well, time will tell. We'll need to accumulate that data, but it'll be very interesting.
So, thank you. Thanks to both of you. You know, as I'm looking around to the names here and knowing a lot of people, we have people from all over the world here today, and we should have kept track of how many countries are here. But one of our friends, our guests from Turkey, and you've talked about vitamins and immunosuppressants, is asking, you know, if she uses immunosuppressants, does that mean she should stay away from vitamins while she's on immunosuppressants?
Yeah, so again, you know, there's not just one vitamin, there are many vitamins. To me, when we talk of the immune system, though, there is one vitamin and it's called vitamin D. And I tell my patients, and from there's data out there and from personal experience, when I have a new patient with a new onset inflammatory disease like scleroderma, I often check vitamin D. And many patients will have low vitamin Ds. And I think, to me, vitamin D, the way I describe it to my patients, it is the oil to your immune system. You need vitamin D. And as I say, often in patients who develop a disease, their vitamin D was low. And I think it's one of the contributing factors to developing autoimmune diseases. So when I have a patient with an autoimmune disease, including scleroderma, I want their vitamin D levels to be as normal as possible, because as I say, it is their oil to their immune system. So whether if you're from a part of the world, if you're from Turkey and you're lucky enough to get vitamin D from sun exposure, that's great. But many people in North America, in northern European areas, and so on, don't get a sufficient vitamin D. And so I prescribe a lot of vitamin D supplementation.
Great, thanks, man.
Thank you. Let's see, what other question have we got here? Sort of more generically or more specifically, what research is there about COVID in scleroderma patients?
Yeah, so I can talk a little bit about my own research. There's a lot of research. But one of the things that we're doing at McGill that's really interesting, there were some scientists, mostly I'll say from Europe and from, who started to draw very big parallels between fibrotic lung disease from COVID and fibrotic lung disease from scleroderma. So all of a sudden people are saying, what can COVID tell us about the lung disease that patients get in scleroderma? Where it gets even more interesting is where you look at the COVID patients who look like they have fibrosis, and you rescan them 6 to 12 months later, and the fibrosis has largely improved. So again, that begs the questions for scleroderma patient. Why is it that in some cases lung fibrosis will be reversible, whereas in scleroderma up until now, we always think that it's irreversible, and if anything, it's progressive. So there's a very large research program right now that's starting up, and that's really becoming quite busy in terms of comparing interstitial lung disease from inflammatory diseases, and we've included scleroderma, of course, but we've also included patients with rheumatoid arthritis who can get lung disease. We've included patients with myositis who can get lung disease, and our comparison is COVID lung fibrosis. And so that's, you know, I think very relevant research for many of our patients with scleroderma who have lung disease. It's going to take time, a long time, to collect that data, to do this very sophisticated sort of research. But I think COVID is giving us an opportunity to learn things for scleroderma that, you know, it's an opportunity.
That's very exciting. Absolutely. Oh, I'm running out of questions here. Brett, have you got another one that you've got ready to go?
Sure. We actually have several questions, and we touched on this a little bit, that are asking about effectiveness of vaccines for the Omicron variant. You know, at the beginning when we started being vaccinated, we weren't getting infected at all. Right? Now that seems to have changed. We're getting infected very little. What do we know about vaccines and how they reduce our likelihood of getting infected, likelihood of getting hospitalized, and so forth with the Omicron?
I'll try to take that one first, and Marie, you can add on. So what we've seen with Omicron is that because this variant is able to evade the immune system, so not the immune system, but evade the immune response that we've mounted with previous vaccine or even with previous infection, we've seen increased risk of reinfection or infection in people who were vaccinated. So if you compare to, let's say, the Delta variant, where the vaccine efficacy against infection was still around 80%, even after 4 to 5 months. We got to Omicron and that dropped to 50% after 4 to 5 months. Same goes with BA2, which is baby Omicron, which is able to even evade a little bit the immune response that you've mounted with Omicron. However, we know that if you get a booster shot, so this was with the first booster shot, we were able to increase our protection against infection back to 80%. However, with Omicron or BA2, that protection against infection tends to decrease quite quickly. So after 4 to 5 months against infection, you've already seen a decrease in protection. However, against hospitalization, even after one booster shot, for the vast majority of people, including those 70 years of age and older, you still see a vaccine effectiveness of over 90% in terms of protection against hospitalization and death. Can't say anything specific for patients who are immunocompromised or who are, importantly immunocompromised. But for the rest of the population, the vaccine effectiveness is still quite good. And so the reason we've recommended a second booster shot now is that we were expecting this rise in cases with the new BA2. And so for people who are at higher risk of complications, so the elderly and those with immunosuppressive conditions, we were able to give that second booster shot so that we were able to increase your protection against back to almost baseline to 80% against infection and, well, against hospitalization. It hasn't changed much. It's still above 90%, but with the booster, it actually is quite good.
Great, thank you. So you mean basically, Caroline, when you say a 90% reduction, right, in risk, that if say hypothetically 10 people out of 100 were going to have something happen, it would drop to one out of 100 if you got vaccinated. Is that right? 90.
I can't hear you very well, Brett. I'm really sorry.
Oh, sorry about that. Not sure what's going on with my sound. Can you hear me now?
A bit. Yeah, I think it's better.
Okay. Sorry, I'm not sure what that is. So 90% reduction. So if 10 people were going to have something out there in the public and they get vaccinated, then it would only happen to one of them.
Exactly. Yes, that's it. So it doesn't mean that it decreases to zero the risk of infection, but if you are vaccinated compared to those that are not vaccinated, your risk is 90% less. So that's exactly what it means.
Great, thank you. We have one comment in the chat that says one of our guests joined late, but want to know if she should get the 5th dose of the vaccination or the second booster. I think Caroline, you already said that yes, that's a good idea.
Yeah, so if you were considered immunocompromised and you were in the group for whom the primary series was a 3-dose series and you got your booster number 1 more than 3 months ago, then you are eligible for booster number 2. And if your immunosuppression is important enough, I think it is important for you to get that booster shot number 2, which would equate to dose number 5.
Great, thank you.
Excellent.
Well, why don't we move to some last comments from our panelists, and then we'll wrap up. And if you're in Quebec, we have one of our few sunny days out here in a long time, and all of those in Quebec can go out and get some vitamin D exposure. In the rest of the world, you have to fend for yourself, because I have no idea what it's doing where you are. Any last comments to leave people with from our panelists? Caroline, would you like to start?
Sure, I think that I'm much more confident now than I was at the beginning because we've had vaccines that actually work. We know that boosting is able to restore your immune response. We have treatments so that if you're immunosuppressed, we have ways of decreasing risk of complications. I understand the fear of people going back to normal living. I mean, we've tried to scare people at the beginning so that they would stay home. That stuck to some people more than others. But we will have to manage our way back into the world. And I think what is most difficult sometimes is, trying to protect ourselves while allowing those around us to have a normal life. And so I've had some patients who said, I really want my children to be in school, happy, have play dates and whatever, but I'm scared for myself and I don't know what to do. And that question came up. But I think because we have vaccines and because we have treatments, we're able to let children play and go back to school, even without masks, and let them go to school in person. Because I had parents writing to me to say, I'm vulnerable. I want my children to be homeschooled. And I don't think that's a good idea for children. They need the face-to-face teaching. They need to see their friends. They need to even fight if they have to, but that's how they grow and that's how they become healthy adults. So, it's scary, but I think we're in a much better position than we were before. And because a lot of people got COVID, it means that we have some protection around us. So we don't need to be entirely protected, all of us. If, in Quebec, we think that 3 million people got Omicron over the Christmas holidays. A few, more percentage are going to get BA2. But that means that the next time a variant comes around, the risk that people get severely infected decreases that much more, even though we'd rather not have anything. But at least I think, it's at least a little bit more hopeful than it used to be. Thanks. You're muted, Brett.
Well, thanks for leaving us on a positive note, Caroline. Marie.
Yeah, I have a comment, and at the same time, maybe it's a question to Danielle, because I think, and I tell my patients, that I actually think we're better off now than before COVID, because first of all, I used to spend so much time telling my patients that they were vulnerable, mostly vulnerable for infections. And I think a lot of the time it went in one year and out the other year. And they didn't really manage that risk. And we ended up with some patients who were very sick. And now with COVID, they got it. Okay, they got it. So that's the first thing. The second thing is, we now appreciate the value of wearing masks. We have demonstrated that so many people, there are so many studies that show that just the idea of wearing a mask reduces our patients' risk of all sorts of infections. We're not just talking COVID, so other viral infections and so on. So I think the awareness that has come here, and some of the masks and the public distancing and the staying home when you're sick, we're better off with that. And then, as Caroline mentioned, we now, the other thing we have to reassure our patients, we treat our patients so much better in the hospital on the COVID ward compared to when I started to see these patients. And the last time I did the ward, our management has improved so much. And now our management is really improving for outpatient management. So there's so many things that should be reassuring to our patients. But I don't know, Danielle, what do you think? Am I being overly, optimistic for our patients?
No, I think this is great. You're laying out facts and things that I think sometimes are overshadowed by the feeling of fear and anxiety. So you're showing us those facts and making sure we remember there's another side to all of this. And maybe on that, I'll end with saying, this is a time that's going to come with uncertainty. We understand that. And you may now just be starting to take what Marie was saying to see some of the positive, which is a great start. Also, you're in a group of, how many people do we have here? We have 58 people. You're in part of a community that's one of the most resilient and caring communities that I have seen for patients. Lean on each other when you need to. There are other people that are trying to decide, when should I go get this vaccine? What did they say at this meeting? Connect with each other for those who are going through similar experiences. And if you find that, doesn't do the trick, you can Google Wellness Together Canada. There's free mental health resources on there, including one-to-one support. I don't work for for them. I'm not trying to make a pitch. I'm just saying it's a resource that could be great for you to access. And if that doesn't work, feel free to speak to your doctor and connect with a mental health professional. We're here. We want to help you virtually or in person with our N95 masks. I have mine in the corner. We make things as safe as possible so that you're not taking on the mental health burden alone. So do remember that.
And thanks, Danielle. And in terms of connecting too, I just typed our website address into the chat box for SPIN, and we can help you connect with your local patient organizations or some of the support group programs that we're doing from SPIN if you do want to connect. Maureen, any last comments from you?
No, I'm basically just tremendous thanks to Dr. Quash, Dr. Hudson, and Dr. Rice, just about, I'm assuming. So, and certainly always to you, to Dr. Timms. This is so reassuring for those of us who have lived in discomfort and fear for so long, to find a comfortable way to transition out of lockdown into reintegration with society is really, it's a really powerful thing. And I thank you for taking the time to help us figure out how to do that.
Thanks, Maureen. Thanks for co-moderating with me today. I second your thanks. We have a tremendous panel today. So thanks to Caroline, Marie, and Danielle. Just a stellar panel today. We couldn't have gotten a better group of experts here. And thanks you. I know how busy you all are. Thanks for making time to do this. I also want to thank John Malcolmson and the team at Scleroderma Canada for reaching out to us and partnering on presenting this for everybody today. We're very, very fortunate. We have wonderful partners, wonderful patient organizations in Canada, Scleroderma Canada, all the provincial organizations, and we're fortunate to partner with all of them. And I think as Danielle said, it's a wonderful patient community. So if you need anything, reach out to your provincial or national patient organization. They're there to help, and they're really good at it. Thanks, and most importantly, thanks to all of our guests for joining us today. We hope that you had a good experience. If you have any questions, please, again, if you go to our website, you can email us, and we can try to get them to the right person. So now I think officially we'll end this. I'm going to go jump in my kayak and be on my way, and hope everyone has a great day.
Thank you, everyone.
Thank you, everyone.
Speak soon.